circumstances. Typically, symptoms include cough, and cough can vary from being very dry cough, irritative, and to present with some minimal production of some phlegm that might be the effect of the pneumonia that has developed. Pneumonia happens in a minority of the patients with severity, but it really happens with a lot of patients suffer pneumonia. So the respiratory affectation seems to be very frequently seen on COVID-19 patients. Now, again, the severe cases only account for a very small proportion of the cases. So we're looking at less than 10% of the overall cases are severe or moderate to severe cases. And only a few of them require an artificial life support, what we call mechanical ventilation or respiration help. And again, that only happens in about 5% of the overall cases. So again, symptoms vary. It can go from minimal cough and no respiratory distress or no shortness of breath to more shortness of breath, the presence of more symptoms, and even the need for help for respiration.
So a relatively healthy person otherwise, if it has a dry cough and feels a little bit down, maybe have a cold-like symptoms, they don't have to, they can be calm and maybe call telehealth, call Care on Demand, or how would you say
that? That is correct. So if you have, I think the key element here is the possibility of being exposed to someone with the disease or being in an area that is known to have the disease. So let's say that you live in an area in which a neighbor or a friend of yours has been diagnosed with COVID-19, and you have started with some fevers and you have some minimal respiratory symptoms such as cough. Now, you probably will contact telehealth in this case, or you go to your primary care provider and be diagnosed with COVID-19, and the recommendation is going to go home, rest, and try to avoid contact with any other individual to try not to spread the disease, because this is really what we want people to be aware of. So I think that one of the most important things to learn and to transmit to the community, if you think or you suspect you might be sick with this disease, avoid contact with other people. So to protect other people that you love and you care of from the transmission of the disease. And that will be the mass majority of the cases. Go home, rest, take some fluids, maybe take some medications to decrease your temperature and symptomatic relief. And as Dr. Martin has mentioned at the press conference, eat healthy and adequate food and try to have a ventilated area where you can really stay there. I wouldn't say isolated, but apart from other people, or at least apart from close proximity to other people.
And just briefly, the most at risk, those folks who are most at risk, can you tell us a little bit?
Yes, again, it is important to differentiate at risk of contracting the disease versus at risk of developing complications. I think we all are at the same risk level of contracting the disease. So it really does not differentiate whether you are young or elderly or you have any other problems as far as contracting the disease. You've been in contact with people that had the disease. You've been in the areas where the disease is more prevalent. You could have contracted the disease, regardless of any other condition. Now, once you have contracted the disease, once you have infected or you have been infected by COVID-19, people with other diseases such as kidney problems, heart problems, lung problems, chronic lung problems, I'm talking about COPD as an example, or cancers, those people or those with advanced age are more prone to develop more complications. So those need, I wouldn't say to request more attention, but just to be absolutely sure that they need to contact their healthcare providers to be advised and to be evaluated.
Anything else you want to add? I think we're covered.
No, I think we really need to highlight that this is, again, nothing to panic about. This is a disease that is mild in most of the patients, that really is transmissible in a very similar fashion that other respiratory conditions such as the influenza or the common cold, and it really has portrayed with a very mild severity. So don't to be scared, but just to be responsible. And again, try to avoid the transmission that way.
Great. Thank you. Done. We're good.
All right. Got it.
Got it?